Hello and good morning to all members of the board. My name's Ashlee Winton and I'm here today to discuss an exciting initiative that's going to enhance consumer experience in the acute medical unit at Robina Hospital. I'm here today to discuss the current organisational environment and culture of my chosen ward, the project proposal I plan to implement in the acute medical unit at Robina Hospital, the project implementation plan to guarantee success, the advantages of the project implementation on the consumer, the staff, and the organisation, and my skills and attributes that are beneficial for my role as a transition nurse trainer and how I will aid in the implementation of the READY system, and the professional development support I need from you for the successful implementation of the READY system. The acute medical unit at Robina Hospital is a part of the Gold Coast Hospital and Health Service. This unit is staffed by 37 registered nurses and 8 enrolled nurses. We are a 24-bed acute medical unit with various illness presentations as there are no specialised wards in this hospital. Independent surveys conducted on the ward suggest the main consumer issue involves multiple different ward admissions and transfers throughout their hospital admission. Prior to admission to AMU, consumers are usually admitted to the medical assessment unit for further assessment and then admitted to the ward. The project I plan to implement in the acute medical unit at Robina Hospital is a READY system with a ward admission flowchart which highlights patients that meet ward admission criteria to streamline the consumer's admission into the acute medical unit. Consumers who have been identified to have rejected prolonged hospital stay will be admitted straight to AMU, bypassing the medical assessment unit if they meet ward admission criteria. This will enhance consumer satisfaction by reducing intra-hospital transfers and handover of care, thus improving patient safety and outcomes. This is supported by a study conducted by Lees in 2013, where consumer satisfaction was significantly increased when intra-hospital transfers were reduced as much as possible. For the effective implementation of this project, the following steps will have to take place. Firstly, a ward admission flowchart will be developed which will outline ward admission criteria to avoid critically ill patients admitting to the ward. Secondly, in-services and education will be provided to existing staff to inform them of new processes and procedures, but also to internally advertise for the role of a transition nurse. Then, the appropriate staff will be hired into their role as transition nurses. Once the positions are filled, education will be performed by me as the transition nurse trainer, the role description of the transition nurse will be outlined, and practical training will be provided. And lastly, I will conduct 1 monthly process reviews and 6 monthly staff reviews to assess the effectiveness of the READY system and also conduct staff and consumer surveys to assess the strengths and weaknesses of this project. So how will the implementation of the READY system be advantageous to the consumer, the organisation and the staff within the unit? Well, firstly, the consumer will be positively impacted by the READY system by promoting the ideals of continuity of care and developing routine whilst in hospital. With the implementation of this system, the amount of wards the patient will transition to will be minimised, and the patient will spend a majority of their hospital admission on the acute medical ward. Through this, the patient will have the same nursing team and same treating team for the majority of their inpatient experience. Additionally, the patient will be familiar to the ward and will feel more comfortable in this space. This will boost consumer satisfaction within the Gold Coast Hospital and Health Service. Secondly, the READY system will promote patient safety by reducing the amount of transitions of care that occur during the patient's inpatient episode. Many incidences occur during the patient's transition of care that can negatively impact on the patient's safety, outcomes, and satisfaction. For example, improper handover during these transitions can lead to increased mortality and morbidity for the patient. By providing the same nursing and treating team for a majority of the patient's admission, less occurrences of transition of care will occur and less incidences associated with this transition of care will take place, therefore improving consumer satisfaction and outcomes. Thirdly, the READY system will support National Emergency Access Targets, or NEAT times, and assist in reducing bed blocking by bypassing the medical assessment unit and streamlining the patient's admission to the acute medical unit. Very frequently, NEAT times are not met at Robina ED because patients are waiting for beds to clear in MAU. The READY system will assist the emergency department in meeting these NEAT times by streamlining the patient's admission straight from the emergency department to the acute medical unit. Furthermore, by streamlining this admission, there is a possibility that the patient's length of stay in hospital will be reduced. A similar system to the READY system was implemented by a hospital in Victorian health system. This hospital saw a reduced length of stay in 37% of medical admissions. It is theorized this is due to early admission, early diagnosis, and early treatment for the patient, thus improving patient outcomes, promoting patient safety, and consumer satisfaction. Additionally, this project is advantageous to the organisation as it presents an opportunity for the organisation to utilise hospital resources and the medical assessment unit more effectively and efficiently. The medical assessment unit can be used more efficiently by only admitting patients projected to have a length of stay to be under 48 hours. This will help reduce bed blocking and allow for a more cost-effective use of the medical assessment unit and their resources. According to the Victorian Health System in 2019, utilising a system similar to the READY system achieved higher cubicle turnaround and reduced overall expenses. And lastly, this project is advantageous to staff members and the organisation by providing an opportunity for promotion for the registered nurses on the acute medical unit. According to Duggar and Ayaga in 2014, presenting promotional opportunities within the workplace to existing staff members can improve employee satisfaction and thus increase staff retention. This promotes consumer satisfaction and safety by reducing medication errors and detecting clinical deterioration. But who is going to lead this project? I believe I would be an excellent candidate for this role because of my skills and attributes that I have developed throughout my nursing career. The skills that I possess that I would find to be beneficial to this role is my patience, compassion, empathy, commitment to lifelong learning, and that I'm approachable. These skills will be beneficial to this role as they will assist me in becoming an educator and a coach to the new transition nurses involved in the READY project. This is supported by a study conducted by Aarons, Earhart, Faranak, and Hurlbart in 2015, which identified the skills to be an effective educator to be patience, adaptability, being a team player, taking risks, committed to self-development and education, and possesses mentoring and leadership qualities. Furthermore, through the use of a multi-leadership questionnaire, I have identified the transformational leadership skills that I possess that I would use to successfully implement the READY project in the acute medical unit at the Robina Hospital. The transformational leadership skills that I'm proficient in are building trust with peers, acting with integrity, coaching people, and inspiring others. However, this quiz identified that I do require development in my ability to encourage innovative thinking. I believe these skills are essential to ensure the success of this project. This is also supported by Fisher 2017, who states transformational leadership skills are essential for implementing a clinical project. In order to implement the Direct Ward Admission Project or READY system, I will need some extra support from you to ensure our success. The first area of support will be in education. I theorise that exposing myself and the transition nurses to the Introduction to Clinical Deterioration course provided by Gold Coast Health will ensure the success of the program as it teaches their transition nurse to recognise and respond to clinical deterioration by declining the patient for a ward admission, promotes evidence-based thinking, and also teaches a Speaking Up for Safety course, which will provide techniques that nurses can use when rejecting a patient for admission. This course also builds leadership skills and gives you guidelines to use when declining a patient. Secondly, the area of support I will need is for the transition nurses to be provided with on-the-job training. Specialty wards of the Gold Coast Hospital and Health Service already utilise the READY system to streamline the patient's admission to their ward. I propose the transition nurses can be trained on these wards to be provided with adequate practical training. The health service can utilise supernumerary shifts to train the transition nurses so that the implementation of this system within the acute medical unit can be as smooth as possible with minimal errors. The benefits of this practical training would be the transition nurses gaining clinical experience in their role, their confidence in performing this role adequately would improve, and all staff would adequately understand their roles and responsibility as a transition nurse. In summary, today we have discussed a proposed direct ward admission project or READY system for the acute medical ward that streamlines a patient's admission straight from the emergency department. The project will benefit the consumer, the staff, and the organisation by decreasing the amount of transitions of care experienced by the patient, promotes continuity of care and routine, and leads to an efficient use of resources within the organisation. Implementation will involve developing a ward admission framework or criteria, in-services and education, interviewing and assessing candidates, hiring process, education and training of new staff to the role, and evaluating the project. I will be successful in implementing this role as I have a good rapport with my peers, I act with integrity, I'm a good coach or teacher, and strive to inspire others, and by implementing my transformational leadership skills whilst educating and leading this project. With the Gold Coast Hospital and Health Service support of education and on-the-job training, I will successfully implement this project.